So knee pain is a common condition with many possible causes,
Yes.
including, let's say, injury from playing sports, overuse, or even just simple everyday activities.
Each year, approximately 12 million people visit their doctor because of knee pain, half of them with damage to their knee cartilage.
The Balancing Act is on location to meet with a physician and a patient to learn more. Take a look.
My name's Courtney. I'm 30 years old. I live in Los Angeles and I work as a pediatrician. In high school, played many sports. Field hockey and softball were the primary ones. And then I actually tore my ACL playing field hockey while in high school, but I had surgery to fix it, recovered from that, and then I started running once I went to college. Once I moved to Los Angeles a few years ago, I started having a new onset knee pain at that point.
Dr. Banffy is a sports medicine physician who specializes in knee cartilage restoration.
Knee cartilage is one of the connective tissues within the knee. So there are really two types of knee cartilage. There's the articular cartilage and there's the meniscus cartilage. So both the articular cartilage and the meniscus cartilage acts as a cushion that protects the bones as we do activities that are higher impact, such as running, jumping, but even walking. When the knee cartilage gets damaged, it starts to deteriorate, it becomes thinner, then there's more pressure that the bone experiences. That can result in pain.
When knee cartilage is damaged, patients may experience pain, swelling, clicking, and locking. For Courtney, her pain started to not only affect her love of running, but also her job as a pediatrician.
In the beginning, it was just related to my exercise, so I kind of, worked through it. I was taking anti-inflammatories, and I would take something before I ran, and then usually after I ran. It got so bad that I stopped running altogether, basically. Over about a 2-year period, I started having pain every day when I was going up and down the stairs. Initially, it's one thing, I think, to kind of cut back on things that you'd like to do in your free time, like working out or exercising. But I think it becomes a lot more significant when it's affecting your day-to-day activities and your professional life. And I couldn't stand on my feet for long periods of time at work. My knee would just lock up if I moved the wrong way, pivoted the wrong way. And at that point, I think other people also saw me struggling at work. It was just time for me to go and talk to someone and see someone in sports medicine to figure out what was going on.
Knee cartilage has a very limited blood supply. You really need a blood supply to allow things to heal. When the cartilage doesn't heal on its own, since it lacks that regenerative benefit, the free ends of this cartilage can actually catch, and that can propagate the tear. That will make the tear larger, the lesion larger, which will then exacerbate the patient's symptoms.
Courtney saw a sports medicine physician and had multiple imaging tests done. Her MRI showed knee cartilage damage, and she was then referred to see an orthopedic surgeon.
The orthopedic surgeon said that I would definitely need some sort of procedure to confirm what the findings on the MRI were, but also probably to repair the lesion. We talked about injections as being short-term solution for pain, but nothing that would probably help me in the long term. I wanted to figure out what the surgical options were, and most importantly, if there were differences in terms of what the rehab looked like and what the long-term outcome data was for patients.
There are several surgical techniques available for treating damaged knee cartilage. Used for more than 20 years, Autologous Chondrocyte Implantation, ACI, has been proven to provide long-lasting pain relief and help patients regain knee function. MACI is a third-generation ACI offering a simpler way to deliver cells and is the only FDA-approved treatment option that regrows a patient's own cartilage cells.
In the patient that's failed conservative treatment, the MACI procedure has successfully been able to restore the patient's knee function and get them back to the activities they want to do. So the first step of a MACI procedure is taking a biopsy of the healthy knee cartilage, typically from a non-weight-bearing surface. Then processed, where it's frozen within the lab. Next, the cells are expanded and placed onto a membrane that can be absorbed back into the patient's own tissues. Then, a MACI implant is delivered the day of the surgery. The implant is then shaped to the size of the cartilage defect, and then placed into this defect area to restore the normal joint surface. After the MACI is implanted, the patients then begin a physician-prescribed rehabilitation program that is specifically designed for them.
I I was most attracted to MACI because I had the opportunity to schedule my own surgery at a time that was convenient for other things going on in my life. I was interested in how innovative and new of a procedure it was and how I had the opportunity to help be part of something that hopefully would be able to positively impact other people in the future.
Generally, after the MACI procedure, the patient is placed in a non-weight-bearing fashion. We need to then take the time with proper rehabilitation to allow these cells to propagate to reestablishing the normal articular surface. Generally, by the first 6 weeks, they've regained their full range of motion. By around the 3-month mark, they have near full strength, but we still need time from a biological standpoint to allow those cells to mature. But by as early as 6 months, people are getting back to some of their normal activities and some of the exercises they want to do.
I felt a lot better after surgery than I was expecting to. I could walk and could do more activity, and even though my surgeon cautioned me, you still have to take it easy because we don't want to damage the graft in any way, but I think I was just surprised by how great I felt so soon after surgery. The rehab was very regimented, and I was in physical therapy intensively for the first 2 months, but I continued for another 4 months after surgery.
Well, generally, I would say the most benefit of the procedure is decreasing pain. The ability to move their knee without having the clicking, the locking. But I also think that the ability to utilize their own cells as opposed to cells from a donor is something else that they truly appreciate. In the patients that have failed the conservative treatment and have elected to proceed with the MACI procedure, they're very pleased by the end of their rehabilitation. They've had restoration of their normal knee function. They've gone back to all of their normal activities. And really, they have no restrictions with regard to the exercises and sporting activities that they can participate in.
Being able to do activities you want to do and be able to go to work without having to worry about knee pain, it was really special once you're kind of so initially before surgery tied to the idea of I can go out and do things, but I'm going to have knee pain. I'm really thankful that I had the MACI procedure done, and I feel like for me and the time in my life that I was in, it was the best option.
It's so great to see Courtney doing so well.
Absolutely. Now, if you're experiencing knee pain, speak with your doctor. And to find out if the MACI procedure is right for you, just visit maci.com/patients.
And you can also go to our website, thebalancingact.com.
So great.
MACI, autologous cultured chondrocytes on porcine collagen membrane, is made up of your own autologous cells that are expanded and placed onto a film that is implanted into the area of the cartilage damage and absorbed back into your own tissue. MACI is used for the repair of symptomatic cartilage damage of the adult knee. The amount of MACI applied depends on the size of the cartilage damage. The MACI film is trimmed by your surgeon to match the size and shape of the damage to ensure the damaged area is completely covered. Limitations of use. It is not known whether MACI is effective in joints other than the knee. It is not known whether MACI is safe or effective in patients over the age of 55 years. Important safety information. MACI should not be used if you are allergic to antibiotics such as gentamicin or materials that come from cow, pig, or ox, have severe osteoarthritis of the knee, other severe inflammatory conditions, infections or inflammation in the bone joint and other surrounding tissue, or blood clotting conditions, have had knee surgery in the past 6 months, not including surgery for obtaining a cartilage biopsy or a surgical procedure to prepare your knee for a MACI implant, or cannot follow a doctor-prescribed rehabilitation program after your surgery. Consult your doctor if you have cancer in the area of the cartilage biopsy or implant, as the safety of MACI is not known in those cases. Conditions that existed before your surgery, including meniscus tears, joint or ligament instability, or alignment problems, should be evaluated and treated before or at the same time as the MACI implant. MACI is not recommended if you are pregnant. MACI has not been studied in patients younger than 18 or over 55 years of age. Common side effects include joint pain, tendinitis, back pain, joint swelling, and joint effusion. More serious side effects include joint pain, cartilage or meniscus injury, treatment failure, and osteoarthritis. For more information, please see full prescribing information at maci.com.